New efforts are underway to track the way New York City has been dealing with the coronavirus. The city, it's a nonprofit local news outlet, is tracking confirmed cases, hospitalizations, and deaths across all of New York's boroughs. So Choi is the senior data reporter for the city, and she's joining us now to talk a little bit more about this. So we have
Hello.
all these different sort of ways to get numbers on this pandemic. Numbers don't always tell the whole story, but they certainly give us some insight. Johns Hopkins has been doing all sorts of stuff, also the CDC, stuff coming from the state. Why did you think it was important to create an independent tool to keep track of this?
Well, the city, our newsroom, is a local newsroom. Our focus is New York City. Since the outbreak of the pandemic, there have been excellent resources to track figures nationwide and in a global scale, but there really wasn't a centralized place for New York City specific figure. So we decided to create one. What we do is we compile various indicators from multiple sources, from the city's mayor's office, health department, the state's health department, also the governor's office. We compile this and we show the most relevant indicators to really contextualize what's happening to New Yorkers without unnecessarily alarming them.
So, Anne, how is this tracker different from the one being used by Johns Hopkins University, which a lot of news organizations have used as a benchmark?
Right. There are a few differences. The main one is that we track the number of probable deaths. Now, that figure is somewhat unique to New York City because it releases the number of people who died of COVID-19 equivalent causes, but were not tested. Not all cities or states report this figure, including Johns Hopkins. We believe that including that information is more reflective of the virus's true impact. We also provide a zip code map of cases so that readers can see how their neighborhoods are doing. We also have publicly unavailable data. Our reporters ask the mayor's office and the governor's office every day to see what the hospitalization utilization figures are and the number of ICU patients. This shows how close to capacity our city hospitals are, and we believe that is another important indicator.
Oh, that's all really interesting stuff. So take us through the numbers. What have you found out so far? What are the areas that are hardest hit in the city?
Right, in the city, Central Queens neighborhoods in Elmhurst, Jackson Heights, Corona are one of the most hardest hit neighborhoods. We also see an uptick in North Bronx areas and also southeastern Queens neighborhood. Now, we know based on our reporting, these neighborhoods are home to many service workers, and we also know Bronx residents tend to have higher rate of underlying conditions that make them more vulnerable to the disease. These are some of the findings that we know, and because we are a news outlet, we're able to go beyond the numbers and contextualize what these findings actually mean.
And that's important. And so I wonder, Anne, with the reporting that you do, with the tracking that you've been able to ascertain, what resources are available on the city to help people in New York receive concrete information on the coronavirus moving forward?
The New York City has information available in their health department website, and also they have a 311 hotline. The city is hiring more people because, as you can imagine, more people are calling in regarding coronavirus with questions and concerns, so they are amping up their service. The city, our newsroom, also has multiple guidelines on how to navigate this pandemic. That includes information on unemployment, information on how to pay rent, or if they have to pay rent, if they're essential workers, what their rights are. So in addition to our tracker, I would say our newsroom is providing essential service.
And so important right now, and I love the city. It's really become a source of news for me on an almost daily basis. So, Anne, we really appreciate it. Thank you.
Thank you for having me.